I think people really do have the right to be very angry at this point, because the process, this legislation is the worst healthcare legislation I have ever read. And I've read all of them for the last 23 years in this province, and most of them from across the country. It is the most undemocratic process that I have ever seen. And I'm going to just explain to you what's happened. And then we have both John Fraser and Joel Harden here from the legislature. So hopefully they'll bring a bit of a report about what's happening with the hearings, and so with the amendments and the hearings and so on, and just, you know, show you just how unusual and how undemocratic this is. So this legislation, which the minister has never admitted is a restructuring bill, 99.999% of it is about restructuring healthcare. It's called Bill 74. They called it the People's Healthcare Act. Ironically, you know how Doug Ford and all his, the people's this and the people's that. And it doesn't actually ever mention patients. The bill doesn't actually say that the goal of the health system or the goal of restructuring is to improve population health. It doesn't say that. It doesn't say that the job of the governance of the super agency or any other entity is to measure and then try and meet population need for healthcare. That, which is, by the way, the first job of a public healthcare system. Not in there at all. What the bill does do is create that one merger at the top, so Cancer Care Ontario, Health Force Ontario, Health Quality Ontario, the 6 agencies, and then the 14 local health integration networks, LHINS or LINS, all merged together. These, as you know, Michael was saying, first there was never any call for that, but they're also hugely different organizations with vastly different histories and capacities and cultures and so on. Cancer care in Ontario is stellar. I mean, we have great cancer care, among the best in the world. What we need is more of it. I mean, there can always be improvements, but it's really great. Why would you throw that in with the LINS, who are hated in a lot of areas for good reason, and have now taken over home care, but they have this kind of weird mishmash of a mandate. They've been restructured themselves. Then you throw that in with Health Quality Ontario, which is supposed to kind of be arm's length and be measuring and evaluating the health system. I mean, none of this actually makes policy sense. But in addition to that, the legislation, and most of the legislation deals with this, it gives extraordinary and unprecedented, so never before in existence in Ontario law, powers to the minister to direct, order, to the super agency, to coerce and order mergers, amalgamations, transfers of service from one provider to another, closures of service, and closures of entire service providers. They call it integration in the Act, and they define integration as service coordination. Yes, that sounds good. Partnerships, that sounds okay, depending on who they're with. And then more ominously, mergers, amalgamations, transfers of service, closures of service, and closures of entire service providers. There are 7 different ways in the Act, just in case they missed one, 7 different ways in which the minister and the super agency and providers themselves can merge, amalgamate, close, transfer, etc., etc. So if you think they're not intending to do it, they put it in the Act 7 different ways, 7 different times. In none of those is there the right to appeal. There's no open board meetings. There's no public governance. There's no oversight by the public in any way. There'll be one super agency in Toronto, and then all of the health providers in Ontario in the minister's vision are supposed to form themselves into 30 to 50 big conglomerates, so groupings of companies through mergers, takeovers, closures, transfers, etc., till you end up with a big conglomerate of healthcare providers. So let me just explain this a little bit. So the bill covers hospitals, long-term care, home care, community mental health and addiction services, community care services, palliative care, air ambulance, e-health, the cancer system, so, and everything kind of in between. Nonprofit community, sort of primary care, and community health centers, right? So it covers 1,800 providers of healthcare services. And the minister would like to merge, amalgamate, and otherwise get them down into 30 to 50 entities. That's the plan. So putting that in context, who here remembers the Mike Harris hospital restructuring? Right, okay. So in that restructuring, there were, what, 350 hospitals at the beginning? So they closed 49, I think it was, around 50 of them. Then they ordered the mergers and amalgamations of the rest of them. At this point, Ontario has 260 approximately hospital sites that are merged into 141 approximately hospital corporations, right? That's what that round of restructuring did. And that cost $3.9 billion. Let me just say that again. It cost $3.9 billion to bring close down 50 hospitals and bring 300 and some odd hospitals down to 141, right? The provincial auditor reported that it cost $3.9 billion. The plan from the Harris government was to cut $1 billion. In the end, they cut $800 million, and they spent $3.9 billion. And that was money spent to close down hospitals, to lay off nurses and support staff and health professionals and fire doctors and so on, transfer service over here, renovate a building over here to move the service into it, rehire or attempt to rehire staff over here and so on, to change the letterhead, change the names of the hospitals, and so on and so forth. Money lost to actual health care forevermore. Imagine what the cost of merging, amalgamating, closing, transferring, etc., 1,800 healthcare providers down to 30 to 50. Because that's what the plan of the minister is. We are the most concerned about this that we've been about any legislation that we have ever seen. This will result, they've given themselves the power in the bill to order transfers of public and not-for-profit services to private for-profit providers. There are no procedural protections. There are no appeals in this legislation. There's no requirement that the Super Board meet openly. They've appointed 12 of the 15 members of the Super Board of the super agency. Those people are, almost all of them, bankers. There's a woman, Shelley Jameson, who is the former president of for-profit long-term care company Extendicare. And you should know Shelley, you've heard of her, right? She was on the Hospital Restructuring Commission under the Harris government. She was the vice president of Extendicare, went to the Hospital Restructuring Commission, ordered the closure of all those hospital beds. Then the Harris government opened 20,000 new long-term care beds, the vast majority of which went to for-profit companies. And then she went back and became the president of Extendicare and reaped the rewards of the restructuring that she fomented across the province. Now she's on the new restructuring commission for this government. And so whose interest do we think that she's going to be serving? I mean, these are companies that benefit from P3 privatization and the closure of hospital beds and the transfers of services from public and nonprofit to private for-profit. And when the minister says, well, you'll still be able to use your OHIP card, I beg to differ, because when you move services out of public nonprofit hospitals, you also move the patients out from under the Canada Health Act, because it doesn't cover long-term care homes and it doesn't cover home care and community care. So those things are subsidized, but they're not fully covered, and your drugs aren't covered, and so on and so forth. And much more of the cost is borne by patients and their families. And does anyone have a family member in a long-term care home or work in a long-term care home? So you would know that there's not enough care in those places for the acuity, that is the complexity and heaviness of the care needs of the residents. And they won't bring in a minimum care standard, as Joanna said, because the for-profit industry has lobbied against it for 20 years because it gets in the way of their profits. But the bottom line is, if you want enough care for your loved one, you hire in extra care if you could possibly afford it, and it is not cheap. It's incredibly expensive. What, $28 I would say per hour for a private PSW, and maybe double that for a nurse? It's beyond most people's needs. That's why we have a public health care system. And when the hospitals turn over surgeries or diagnostics to private for-profit clinics, those clinics, we've phoned everyone in Canada, we've done it 3 times, and we've caught them red-handed, selling healthcare services for money. So they bill OHIP, and then they bill patients hundreds or thousands of dollars above OHIP for their services. They are a real and present danger to single-tier Medicare in this country. They do undermine the Canada Health Act and the principle that healthcare be provided to everyone based on need and not how wealthy you are. And the costs in those private clinics have gone through the roof. For cataract surgeries, private for-profit cataract surgeries, in violation of the Canada Health Act and Ontario law, the clinics are charging $1,500, $2,000 an eye. For a surgery that OHIP pays the doctors $500 an eye. So when you think like, oh, doctor-owned clinic doesn't sound so bad, these doctors are charging seniors on fixed incomes $1,500 an eye and billing OHIP too $500 an eye for their cataract surgeries. And more chain companies are buying up those clinics. The people who are poised to end up at the top of the heap of your regional conglomerate, say you are one of the 30 regional conglomerates, will be the chain for-profit companies, the large hospital CEOs, the companies like Centric Health, one of the largest for-profit healthcare companies in the world, that has moved into Canada and wants to sell integrated care using the same language as this legislation, where they take hospital care, primary care, rehabilitation, and so on. They combine it together and they sell. It's a for-profit business for this chain company. You know, they, you can bet, are already making bids to take over services. The for-profit long-term care homes want to take over the chronic care hospital beds and the convalescent care hospital beds from our public non-profit hospitals. The large, the for-profit, the ones that can hire consultants and work across the province developing bids and developing models to take over services are going to be the ones who are able to do that. And the small local agencies, the small not-for-profits, the small rural hospitals, et cetera, are going to be the ones that actually lose. And in the end, of course, we will see for-profit privatization of our healthcare unless we fight now to stop it. I'm not going to take too much more of your time, except to say that the process by which this bill has been rammed through the legislature is odious. I looked at the last 2 rounds of restructuring under the Liberal government, the Lynn legislation that was brought in, sorry John, but we felt that it was very undemocratic at that time, and there were 5 public hearings and a month and a half's notice for that legislation. The Harris era restructuring, there were 15 days of public hearings, even for that legislation. I've never seen a case where a giant law that impacts 18 million people's healthcare services that communities have spent 100 years building and donating for and volunteering for and trying to develop for their communities, that they would take the power, take away people's local control, all last vestiges of local control over healthcare without any public consultation at all, without any process for any kind of meaningful public input. There were, in the end, 2 part days of hearings in Toronto only, and I'll leave it to you to talk about what's happening now with the legislation. So at the end of the day, we asked for key amendments. We asked for the bill to be repealed. We don't expect that, but we asked for key amendments. We asked for no transfers of public nonprofit to private for-profit, no reductions in any local healthcare service, no closures of any local, small, or rural hospital, no loss of jobs or reduction in positions, because there are shortages already all across healthcare, and healthcare workers have already been stretched through restructuring for the last 20 plus years. So we asked for these clear amendments in each of the sections of the legislation where they've given themselves extraordinary restructuring powers. This week, the Tories are going to have to either vote down those amendments or accept those amendments, and we will make very public, and I hope you'll work with us to do that, exactly what they do, so that it's laid bare for the people of Ontario what the intention of this legislation is. As Michael said, they're going to get the legislation through in one form or another. They have a majority, but that is not the end of the fight. That is the beginning of the fight to protect public health care in this province, and we will fight them inch by inch by inch. We will surround the local hospitals like we did in Hamilton when we saved the Henderson Hospital. We will, we'll hold a referendum to stop the for-profit privatization of our healthcare, and we'll seek 1 million votes, and that will stop the for-profit privatization of our healthcare. And when they come after the healthcare workers who have spent their lives providing care for us, we will support them as they fight back against the government that tries to take away their basic rights. Please join us with that. Mayor, please. Are the sign-up sheets going around? Okay, so everybody who signs up, please, we'll get in contact with you with the next things that you can do, and we can talk about that more in the questions and answers. But the first event that we're doing is April the 23rd. We're asking all of the community to support the workers and wear a sticker that says "Stop Healthcare Privatization," just like the cover of the leaflet. And we'd like to leaflet all through the community on that day. Busy areas, outside grocery stores, outside the liquor store, outside busy convenience stores, the emergency department, wherever we can, wherever there's a lot of people, leaflet everyone, hand out stickers, and get everyone wearing them if we can. So if people will volunteer to help with that, that would be great. We need a massive show of strength at Queen's Park on April 30th outside the legislature. Well, the legislature is sitting, and we're asking all of you to please come. Are there people that will come to Queen's Park on April the 30th for the giant healthcare rally? Great, thank you. Please sign up at the back. We'll have as many buses from Ottawa as we can fill, so please spread the word. And then after that, we'll hold a summit with the leadership of all of our local health coalitions and our central leadership, and we'll plan the next step, which I hope will be a referendum to stop the reductions in service, and we'll ask people, vote yes or no. Do you want to see your local healthcare services reduced? Do you want to see for-profit privatization? Do you want to see mega mergers? Let's let the people of Ontario have a say in that. Thank you very much.